Hello, everyone. My name is Henry Silverman, and I'm chair of the Ethics Committee at UMMC. And I would like to take about 5 minutes to tell you about what this committee does. So let me share my screen and begin with the presentation. So the formal name of the Ethics Committee is the Ethical Advisory, or the EAC. So I would like to discuss why we have an Ethics Committee, what we do, and how to contact us. So why do we have an Ethical Advisory Committee at University Hospital? Well, I like to say that medicine tells us what we could do, but ethics tells us what we should do. Medical ethics is guided by the 4 principles of ethics: autonomy, beneficence, non-maleficence, and justice. And we have ethical dilemmas when we have conflict between these ethical principles. In the last 10 years, it's been recognized that to help resolve these ethical dilemmas, one needs special expertise in ethics. That's one reason why we have an ethics committee. More formally, in 1986, Maryland was one of the first states to pass a law requiring that all hospitals establish an ethics committee. And hence, in 1988, University Hospital established the EAC. Also, the Joint Commission requires a mechanisms to address ethical issues involving patient rights, and having an ethics committee is one way to fulfill this standard. So what are we all about? We're a multidisciplinary committee consisting of about 15-20 members, including physicians, nurses, social workers, case managers, chaplains, and members from palliative care. We hold formal meetings once a month, the second Tuesdays of every month from 11:30 to 1 o'clock. And during these meetings, we do retrospective review of ethics consults and also review of current ethics consults. And we also discuss organizational ethics issues as well as they come up. So this slide shows the major functions of the ethics committee. The one major function is ethics consultation, where we help with ethical decision making. We provide ethics education, help the hospital with developing policies that has an ethics component, and we also do research. I'll discuss each of these functions in the next few minutes. Regarding ethics consultations, the first thing I like to point out is that we do not make decisions for patients, families, and healthcare providers. Rather, we offer advice and recommendations. We facilitate communications between the stakeholders, clarify medical facts, discuss options for treatment, offer guidance, and resolve disagreements between the stakeholders. This slide shows the number of ethics consultations we have done in the last 20 years. As you can see, we've been increasing the number of consults we have done, and essentially every year we do more than 140 consults, which constitutes a busy ethics service. This slide shows who are our consult requesters in terms of services, and essentially we get ethics consults from medicine, surgery, trauma, and all the other services in the hospital. This slide shows the individual consult requesters. We get consults from attending, house staff, nurse, social work, and clinical case managers. And sometimes we get direct calls from the patient and the family requesting an ethics consult. One thing I like to emphasize is that anyone involved in the care of the patient can call a consult. One doesn't need any special permission from anyone to call a consult. However, if one does call a consult, obviously it's recommended that they discuss this with the other members of the team. This slide shows the types of consultations that we do. Majority of our consults involve foregoing life-sustaining treatments at the end of life and also at the beginning of life. So we have a presence in the neonatal unit as well. We try to resolve conflicts between stakeholders, meaning between family members and healthcare providers, and also between healthcare providers themselves. Other types of consultations include are patients' wishes being followed as documented in the advance directive? When is treatment medically futile? And I like to mention that Maryland is one of the few states that actually has a law describing what is medical futility. Other consults involve who could serve as the patient surrogate, determination of patient competency, issues regarding privacy and confidentiality, and also whether hospice is an option for the patient. In regards to ethics education, we have two major roles in this venue, a system-wide ethics rounds and online education. Specifically, we have virtual ethics rounds about every other month on Fridays from 12 to 1 via the Zoom platform, and participants can earn a maximum of 1 CME credit per session. This slide shows that we also offer self-paced courses. These are asynchronous online courses, one course in professionalism and another course in medical ethics. In regard to policy analysis, we have helped the hospital develop their policy on foregoing life-sustaining treatments, brain death policy, and a policy on futile treatments. In terms of research, we've done 2 studies in the last few years. One study involved the prevalence of moral distress among nurses caring for patients with COVID-19. This was a focus group discussion study. And we recently completed a study investigating the perspectives of the ethical climate for decision-making among the professional staff in the ICUs. And both papers have been published, and the last one was published in the BMC Medical Ethics. So let me end by discussing the presence of the EAC on the hospital intranet. Essentially, one goes to the main page. You could click on physician resources or type in EAC, and you get this screen here, and then you could click on Ethical Advisory Committee, and you come to the main page of the Ethical Advisory Committee, where we have several useful resources. So how does one request an ethics consult? Again, let me remind that anyone involved with patient care can request an ethics consult. We are available 24/7. There is such a thing as an emergency ethics consult Friday night during the weekends, and we provide that 24/7 service. You could contact us by calling my cell phone number, or you could do it via Tiger Connect, either UMMC Ethics Consult or directly to me. Let me say thank you very much for listening to this presentation. And since this is a recording of my presentation, let me encourage you to email me if you have any questions whatsoever about the Clinical Ethics Committee. So again, thank you very much for listening to me. Have a good day.